Greetings, thank you for being with us today. My name is Sabine Rakotomalala from the Global Partnership to End Violence Against Children.
And my name is Alex Butchart, Coordinator for the Prevention of Violence at the World Health Organization in Geneva. What we'd like to do in this presentation is to introduce the INSPIRE 7 Strategies for Ending Violence Against Children technical package. We're delighted to be able to do this and to have all of you here because it demonstrates a sign of real intent to make a difference. And we must make a difference. Globally, an estimated 1 billion children, or every second child, suffer some form of violence each year. Homicide is among the top 5 causes of death in adolescence, with boys comprising some 80% of victims and perpetrators. For every homicide, hundreds of mainly male victims sustain injuries as a result of youth violence. 1 in 4 children suffer physical abuse, and nearly 1 in 5 girls and 1 in 10 boys is sexually abused. There are 6 main types of violence, and these occur at different stages in a child's development. Child maltreatment, usually at the hands of parents, caregivers, and other authority figures, occurs during infancy, childhood, and adolescence, often in schools, in homes, and in orphanages. Bullying often takes place in schools and is typically between children who know one another, and it also occurs online. Youth violence occurs among children aged 10 to 17 years. It involves physical assault with weapons and can involve gang violence. Intimate partner violence occurs against girls within child and early or forced marriages, and among romantically involved adolescents is often referred to as dating violence. Sexual violence includes forced sex and non-contact sexual violence such as harassment, and emotional violence or psychological violence includes restricting a child's movements, ridicules and threats, and witnessing violence between parents. Violence against children can have acute and lifelong health consequences. Injuries, which can result in death and disability, health risk behaviors such as smoking, alcohol and drug abuse, unsafe sex and violence, mental health problems, including suicide, maternal and child health problems, and via these, communicable diseases such as HIV, and non-communicable diseases such as cancers, cardiovascular disorders, and diabetes. As such, violence against children is a significant problem in itself and a major risk factor for many top priority public health conditions. Ending violence against children, or more realistically reducing its prevalence, demands collective action, and the INSPIRE technical package is intended to help us go from this, where separate stakeholders are moving in different and even opposite directions, to this, where all stakeholders are moving in the same direction to achieve prevention effects bigger than the sum of their individual contributions. INSPIRE, 7 Strategies for Ending Violence Against Children, is a technical package made up of 3 publications. Each letter of the word INSPIRE stands for a strategy. I for implementation and enforcement of laws, N for norms and values, S for safe environments, P for parent and caregiver support, I for income and economic strengthening, R for response and support services, and E for education and life skills. The core document shown here sets out what we can do to prevent violence against children. In the core document, each strategy includes evidence-based interventions organized into different approaches and highlighting which sectors should be involved. A section on cross-cutting components emphasizes the importance of monitoring intervention uptake and effectiveness. And a final section summarizes issues to consider around implementation, which is more fully dealt with in the handbook. The Inspire vision is a world where all governments, with the strong participation of civil society and communities, routinely implement and monitor evidence-based, multi-sectoral interventions to prevent and respond to violence against all children and help them reach their full potential. This vision statement contains three key concepts: evidence-based, which means using what science has shown to be effective; multi-sectoral action, since we can only make a difference by working together; and prevention. 6 of the 7 strategies are about prevention, and 1 concerns response. You can get more information on these concepts in the Inspire documents. And now over to Sabine.
Thank you, Alex, for this introduction. The next set of slides describes some of the evidence-based strategies mentioned in Inspire. The first one is on implementation and enforcement of laws. Laws that criminalize violent behavior are important for deterring potential perpetrators. But just as important are laws that address risk factors, such as firearms. In this example, introduction and enforcement in South Africa of the Firearm Control Act saved over 4,500 lives, including many adolescents, across 5 years in South Africa's main cities. As you can see, firearm homicides declined much more than non-firearm homicides. The second strategy is strengthening norms and values. Strengthening norms and values that support nonviolent relationships is about changing the idea that forms of violence are acceptable. Children witnessing domestic violence between parents is one of the ways by which such violence is normalized and increases the chance for these children to commit violence themselves. Interventions that prevent intimate partner violence are thus important in preventing violence against children. SASA, a community mobilization program developed in Uganda, reduced intimate partner violence by 52% and is estimated to have decreased the proportion of children who witness such violence by 64%. The third strategy is safe environments, one that we often forget. Safe environment focuses on modifying the social and physical environment to foster positive behaviors. For example, the Cardiff model reduced hospital admissions for violence-related injuries by 42% and police-recorded injuries by 32%. The intervention involves combining data from hospital emergency departments as well as from the police in order to identify hotspots where violence occurs, such as bars, nightclubs, or other gathering places. And then with community workers intervening to reduce the risk factors in these settings. The fourth strategy that we look at is parent and caregiver support. Parenting is key for children. Parenting programs generally aim to reduce harsh parenting practices and create positive parent-child relationships. Support can be delivered through home visits or in groups, where parents discuss their children's development and learn how to adopt positive parent practices. In the USA, the Nurse-Family Partnership Program led to a 48% reduction in child maltreatment. Income and economic strengthening. This entails providing cash transfers, often together with parent training or education on gender norms. By way of example, Image, presented here, pairs microfinance with education on HIV/AIDS, gender norms, and domestic violence. A trial of Image in South Africa found that it reduced intimate partner violence by 50% among women in villages that received the intervention. As noted earlier, this will have reduced the proportion of children witnessing domestic violence, and with that, the likelihood of their subsequent involvement in violence. Children who've experienced violence may require access to good quality health care, social welfare, and criminal justice support services. These can help to break the cycle of violence in children's lives and helps them to recover if violence has occurred. Trauma-informed cognitive behavior therapy is one intervention mentioned in Inspire. A review of 11 trials found that it reduced trauma symptoms and functional impairment among children and adolescents exposed to violence by 37% when delivered to individual children and by 56% when delivered in a group format. Lastly, the E of Inspire, which stands for education and life skills. Gains in education protect against victimization and perpetration of violence. This strategy involves approaches such as increasing school enrollment and providing life and social skills trainings in schools. A review of hundreds of life and social skills training programs found that they reduced aggressive and abruptive behavior in school settings by 25% when they were delivered to all students, and by 33% when they were targeted to high-risk students. I'll hand over to Alex to continue the presentation on what we can do and how we should be doing it.
Thanks very much, Sabine. Moving from the core document on what we can do to prevent violence against children, the handbook shown here provides detailed information on how to implement the package. The 7 strategy chapters help users to choose between the different interventions based on their fit with their existing resources and the prevailing risk and protective factors. To do this, it explores the following questions. What can I and what should I do in my context? What are the core intervention components? What will it cost and what will it save? What human and other resources are required? Where can I get more information? And how do I know if it's working? Each strategy-specific chapter ends with an implementation worksheet. This guides users through the process of choosing interventions that are appropriate to their context. It covers the assessment of existing interventions in the current environment, intervention selection, partnership building, resource needs and costs, adapting approaches to the local context, and planning for monitoring and evaluation. The third and final component of the Inspire technical package addresses the key area of monitoring, and it's the indicator framework shown here. The document provides 3 sets of indicators: output indicators, outcome indicators, and impact indicators. There are 4 to 6 indicators per strategy, 10 that cover exposure to violence, and 2 each on cross-cutting issues. There's no requirement to use all the indicators. Wherever possible, the indicators are based on existing questions from widely used surveys, such as the Global Schools-Based Student Health Survey, the UNICEF Multiple Indicator Cluster Survey, and the Violence Against Children Survey. For each indicator, there's information about its purpose, possible data sources, sample questions, and how to calculate it. To conclude, it's over to Sabine once more.
Efforts to enhance programs and policies within a country are really strengthened by supportive international partnerships. The Global Partnership to End Violence Against Children was launched in 2016 and promotes uptake of Inspire as the way ahead in its pathfinding countries. To conclude this overview of Inspire, it's helpful to list 5 key elements that underlie effective collective action, as identified through reviews of several successful public health communication initiatives. These are, firstly, a technical package, secondly, monitoring, thirdly, partnerships, fourth is communication, and fifth is political commitment. We hope that by 2030, as a global violence prevention community, we can look back at our achievements. We hope that we can monitor uptake of Inspire. We hope that we can show that we've been able to communicate with one voice. And most importantly, that we can show that we've achieved collective impact towards Sustainable Development Goal 16.2 to end all forms of violence against children. I really want to thank each and every one of you for being here today, for listening. Only together will we be able to make an impact in the lives of children around the world. For more information, please don't hesitate to download materials on the website here mentioned, and I thank you for your collective action to end violence against children.